Hello, how are you? My name is Rocco, and I'm going to be your student nurse for today. I'm just going to start with your name and date of birth, and I'm going to check that to your little name tag here. So, Miss Matilda Jackson, January 10, 1945. You're the right person, right patient. I'm going to start with giving you some privacy here, and if you have any pain, discomfort, needing to go to the washroom, anything like that before we begin, no? Okay, that's good to know. I'm going to first adjust our bed here to a good working height. Right here. And if you're okay, I'm going to begin the wound assessment. I'm going to place my gloves on, like so. Okay. And if you have any pain, discomfort, or anything you're worried about, just go ahead and let me know while I do this here. So I'm just going to quickly take this down, roll this up, expose your wound dressing here, quickly take it off, and assess it for redness. So we have some redness. We don't have much swelling. There's no discharge coming from it. There's no signs of infection. So your wound looks pretty good so far. I'm going to go ahead and dispose of this. And we can start with a sterile field. Actually, before we do the sterile field, I'm going to quickly just assess the depth and width and length of your wound. So we can do that with this cotton swab here. It's from head to toe, so we have replaced tip to tip, end to end. Okay. I'll just measure it in centimeters since we're using the metric scale here. So we have what appears to be a 14 centimeter long wound from the widest points to the tip. Okay. We've got ourselves a around 3 centimeter long or wide wound. And in terms of depth, we've got ourselves also about 3 centimeters in depth. And I can dispose of this and of my gloves, and we can go ahead and start a sterile field. So to begin a sterile field, I'm going to have the table here positioned in such a way that my back will never be turned to it or against it. We have the sterile field placed right here on the table, and what we're going to do is we're going to pinch it, move it away, the first flap, the second flap away, making sure not to touch within 1 inch of the sterile field's pair of forceps that we can recover from one of the folds. Again, inch away, and use the forceps to adjust the field. Okay. Okay. Place the forceps such that the tips are within the sterile field and the handle portion of it is outside of the sterile field, so as not to contaminate. And to demonstrate adding something to the sterile field, we can go ahead and peel it like a banana, turn this gauze packet downwards and allow it to drop into the sterile field, and we can just go ahead and dispose of the pack that paper. And that would conclude the demonstration.